Swami Vivekananda once said, and I quote, "The cheerful mind perseveres, and the strong mind hews its way through 1,000 difficulties." A very warm welcome to our keynote speaker, Dr. Ashish Deshpande, all the esteemed faculty members, respected panelists, fellow Christites, and the audience who has joined us from far and wide. I am Jane Sebastian, and it is my privilege to be the moderator for this session. Daksh is an annual education and career guidance fair organized by the Student Council of Christ, deemed to be university. It focuses on the various opportunities made available to pre-university, undergraduate, and postgraduate students. The platform enables students to acquire knowledge and make informed choices regarding their higher education and careers. Career Dialogues is a distinctive feature of Daksh, wherein eminent and established figures from diversified fields are invited to share their invaluable experiences accompanied with their expert opinion about the future prospects lying ahead for students wishing to pursue a career in these fields. It gives me immense pleasure to introduce our speaker for the session, Dr. Ashish Deshpande, who will be gracing this occasion with his insights on future of mental health and well-being. Dr. Ashish Deshpande is a psychiatrist practicing in Mumbai from 1996. A life fellow of the Indian Psychiatric Society, Sir was the president of the Bombay Psychiatric Society from 2015 to 16 and has been associated with the Directorate of Mental Health, State Government of Maharashtra in various committees. Sir has been working in the field of school mental health, de-addiction, gender sensitization, and age awareness at various levels. The recipient of the Bombay Community Public Trust Scholarship, Hinduja Foundation Scholarship, Indian Association of Retired Persons Scholarship, and the Yadi Fatke Scholarship for Social Issues, he takes great interest in familiarizing the world with mental health by using the print and the electronic media, Satyameva Jayate alcohol episode being the most celebrated effort. Alcoholic Anonymous members in nearly all the states of India are familiar with Sir's guidance and views. Sir is associated with Anmol Jeevan's School for Relapse Prevention, Wilson Smith Recovery Services USA, and is developing experience-based treatment models in addiction. Internationally, Sir has been invited for lectures at various forums by the International Federation of Aging, World Congress of Psychiatry, World Convention of Alcoholic Anonymous, and Moroccan Psychiatric Society. Sir is currently familiarizing teachers and educationists with the role of mental health in education and learning, and familiarizing primary care physicians about early stage interventions in substance use disorder. Sir, we are immensely and extremely excited to hear from you. Before I hand it over to you, sir, I would like to point out for the benefit of the audience that any questions for the speaker can be posted in the comments section of the YouTube live stream. I also request the audience to please note that an attendance cum feedback form shall be put in the YouTube comment section that will be utilized for monitoring the attendance during the session. Without further ado, I humbly request you, sir, to begin with your talk. Over to you, sir.
Thanks, Jane, for a very good introduction.
My pleasure.
And pardon me for my bad throat. Don't worry, I have tested myself just recently and I'm negative for COVID.
Please make yourself comfortable.
Yeah, so pardon me for my bad throat. It's always a pleasure to talk to students or people who are passionate about what they are learning. And I always felt that when I was a student some time back, I missed this kind of interaction with my seniors. So I congratulate Daksh for this fantastic effort. In fact, I think the last I have seen this kind of interaction happening was in Mumbai, where one of my colleagues usually conducts such programs. And I took a leave from him and started a program called Career Adda. And that seems to be working well with students of various faculties. Today, for the next 30 or odd minutes, I will be talking about future of mental health and well-being. Well, I'm a psychiatrist. I did my education in KEM Hospital and started practicing psychiatry, little did I know that in psychiatry, there is a lot of emphasis on community psychiatry. As I learned over a period of years, through my mistakes and through my shortcomings, I tried to find out how I can get better. And I think very honestly, I have tried to continue my learnings in a different way. And whatever I learned from these experiences, I would like to share with you. And I hope that from my learnings, you will be able to find your own destiny, your own way of looking at your own careers. So let me just put a disclaimer saying that I'm not going to tell you how you should make a career. Okay, but probably I'll be sharing about what I did when I was trying to make a career. Have I made it? I don't think so. It's a process, and it will continue probably till my last breath. So, what is you have chosen a field of mental health, and what does mental health in India current scenario? Well, there are different opinions about how many people have mental illnesses in this country, but it ranges from 90 million to 150 million. Uh, People require active mental health intervention. The 150 million figure is quoted by um, Niemans, and 90 million people is quoted by British charity on mental health research, which conducted a project in 2019, supported by World Health Organization. Uh, Unfortunately, Niemans also said that of the 150 million that probably had a mental illness, only 30 million are probably getting some sort of intervention. So that means remaining are not getting anything. The British Charity on Mental Health Research Project also gave an extremely um, startling fact, and that was that in the organized sector, that is about 8% of India's the labor sector, about 8%, 42.5% of India's corporate sector suffer from anxiety or depression. Now, in a separate research that I had conducted for Yadi Phadke Foundation, Yadi Phadke was a social scientist of eminence from Maharashtra. And I worked with senior citizens in unorganized sector. So loom workers, farmers, people working in film industry. So when they become senior citizens, so what do they go through? Because they are totally unorganized, no supports, nothing. And I found that the incidence of depression was nearly 60%. And they continued to work till the age of 70 when their longevity was 72. So that means till the time they could work, they continued to work. And then they probably had bad health and had a very sad death. Lancet Global Health Study says that suicide is the most common way of death amongst young adults. And we all know that. And in India, we have 35% of our population, which is in the age group of maybe 15 to 39. Okay, so obviously, if suicide is the highest rate, it is said that up to the age of 25, there are about 1,800 suicide attempts every week. Every week, there are 1,800 suicide attempts. I have no idea about how many they get really converted into, but this is a huge number. And most of them, about 70% of them, are because of organophosphorus compounds. And these organophosphorus compounds are easily available. And there is an effort by Indian Psychiatric Society to make availability of organophosphorus compounds difficult for people so that the impulsive attempts of suicides are prevented. It has been passed by Parliamentary Committee in 2005. The law has been passed by the Parliamentary Committee in 2005, but it is still not implemented. The reason? Organophosphorus compounds is a big business, and if there is a law, then the profits are going to go down. I don't see any other reason. Okay? And since 2005, it is just cooling its heels. Because of this problem of deliberate self-harm, the WHO in 2019 had a theme which said that mental health promotion and suicide prevention. And and what has India done? We'll try to see. Of course, all these figures are pre-COVID. Okay, the SARS virus epidemic in North Africa generated 29%, nearly 30% more psychiatric illnesses, anxieties and depressions and post-traumatic stress disorders. So all the figures that I've quoted are pre-COVID. Okay? Now, post-COVID, I don't know what's going to happen. It's going to be difficult because there's going to be a impact of the virus on the health and the emotional aspect, not only because of bereavement, but because of economic losses, educational losses, the stresses of uncertainty of future. One doesn't know how big these figures are going to get. So what are we doing about it? Well, India is a signatory to some international documents, and because of that, we have to have a mental health budget. So how much does India spend? India spends about 0.05% of its budget on mental health. Okay, it's supposed to spend 0.05. It's budgeted. Okay? Does it get really spent? In 2018, rupees 500 million were allotted for mental health. In 2019, they were reduced to 400 million rupees. Still, the actual spent on mental health has been 50 million in the same year. So there is allocated 400 million, but still the spent amount is just 50 million. Let me tell you how gross this is. Okay, this is the amount spent by our Mr. Mukesh Ambani, who makes it in 3 hours. Okay, he makes the same amount in 3 hours, or maybe a day's expense for a trip abroad by our Prime Minister. Okay, or a cost of a Rolls-Royce car. Okay, that probably will give you an idea about how conjuice we have been, miser we have been about spending. So if you calculate it to per person with mental illness, it comes to 33 paise in a whole year. Okay, it is just 33 paise. India spent on the International Yoga Day, of course, 345 million. Okay, but there was no major awareness program on Mental Health Awareness Day. Okay, I thought that yes, Yoga Day is essential and it just does a lot of good to the mental health of people. But I think mental health awareness program should not have been gone unnoticed or untouched. When especially the economic loss estimated to Indian economy due to mental health crisis is expected to be more than $1 trillion US. $1 trillion US because of absenteeism, because of lack of job satisfaction, lack of productivity, or sub-potential productivity by 2030. That is the estimate of WHO. Now, who are the warriors? We talk about COVID warriors, right? Who are the warriors? I tried to Google how many mental health professionals are there. Unfortunately, I got data only on psychiatrists. There are 9,000 psychiatrists. Okay, I tried to find information on psychologists. I couldn't get it. Okay? I tried to talk to a few colleagues who are senior psychologists, and they were also not able to tell me from where I would get. Somebody said that Rehabilitation Council of India would have the data, but that council is very difficult to approach. So we have 9,000 psychiatrists, and it is 1 per 100,000 people. That's what person with mental illness is. That's the estimate. 90 million being the population of PMI, 90 to 150 million. Now, it is desirable to have 3 per 100,000. So we are 18,000 psychiatrists short. And I believe that psychiatric illnesses, the incidence of psychiatric illnesses, somewhere ranges between 8 to 15%. Okay, that's the range of psychiatric illness. But what is the range of psychological distresses? Okay, probably all of us sometime or the other go through a psychological distress. So obviously the need for psychologists is going to be more than the need for psychiatrists. Now that's my simple calculation. So if we are 18,000 short psychologists, whatever number of psychologists are being trained, I feel that we are going to be at least maybe 5 or 6 times the number of psychologists that we train short of the total requirement that we have. So is the situation absolutely grim? Okay, I don't believe that. I believe that there is a silver lining to each dark cloud. And as I was saying, that India is a signatory to Convention on Rights to Persons with Mental Illnesses and Disability. We signed it long time back, sometime in 2007. And so we are obliged to look after the people's mental health. Now, the Supreme Court of our country has said that right of life has been interpreted in a different way, usually. And it is not just safeguarding the mere act of breathing and existing, but ensuring the quality of life and human dignity. Okay. Now, in quality of life, if there is one organ in our body that we are continuously aware of, then it is our mind. And the mind decides our quality of life. I've seen many street beggar children who are extremely happy on Bombay streets at the corner, at the signal. Okay. Yes, when the signal is red, they immediately make a crying face. Okay, they would have a better future as an actor. I always, sometimes I talk to them, and I feel that they are fantastic. The way they are able to change their expression with red light and green light is amazing. In 2017, we passed a historical landmark, and that landmark was National Mental Health Care Act. So in 2017, it was passed in the parliament, and it is the law of the land. It provides, or it insists that to provide for mental health care and services with mental illnesses, and to protect and promote and fulfill the rights of such persons during delivery of healthcare and services. So it is now mandatory that anybody, okay, who is serving mentally ill, okay, even in the administration, okay, have to follow this particular mental health care, because it's now a duty. It's not only a right of the individual, but it's the duty of the health professional or health administrator. But unfortunately, again, very few state mental health authorities have till now formed the state mental health boards. Now, these boards are constitutional bodies under the Mental Health Care Act. Okay? So these boards are not yet formed. So obviously, because those boards are not formed, the further actions on the Mental Health Care Act cannot be taken. Now, if I have to understand the delivery of mental health, because it's going to be important for you to deliver mental health in future, you need to understand the government structures to which you would be catering. Now, we have a National Mental Health Care Act, and we have state mental health bodies which have their own programs, which is run by the civil services. So the administrative officers are aware of the mental health program that the center has decided upon. And under the administrator, the health authorities, we have district hospitals and mental asylums. Okay, now they used to be called mental asylums, but now they are called hospitals for mental health. Okay? So we have district hospitals, we have hospitals for specialized mental health. People working with district hospitals and hospitals for mental health and tertiary care hospitals, they decide the district mental health program. So whatever mental health program that needs to be done, they try to bring it together with the state health program. So it could be immunization, it could be water hygiene, it could be anything, polio inoculation, whatever it could be. They try to integrate the mental health with the health program. So that is the district mental health program. And since 1996, it has been integrated with the district mental health program in a big way. Then we have the primary healthcare centers, okay? And the primary healthcare centers are the interfaces between the health system and the end user. Now we just have 23,000 primary health centers in India. Now that means that we are covering a huge population and we have only 23,000 primary healthcare centers. In Ayushman Bharat scheme, okay, there is a provision for health and wellness centers. And this is, I think, a fantastic opportunity. And this health and wellness center, HWCs that they are called, it is expected that by 2022, there would be 1.5 lakh health and wellness centers. Okay? And these health and wellness centers would not only be outposts for the outreach centers for the primary healthcare centers, but they would have internet facility, they would have a screen, and people can come there. So the remotest places in India, they're trying to cover through these health and wellness centers. Would they have doctors sitting there all the while? No, we don't have that kind of force. So we would probably have some kind of a barefoot doctor or a lay counselor or some kind of a health worker who is not a doctor, probably employed there part-time, somebody from Gram Panchayat. I don't know how exactly it's going to work. But good thing is that they do have an agenda where screening and basic management of mental health, okay, is included in the agendas of the health and wellness center. So that means if there are 1.5 lakhs of health and wellness centers, well, they would require human resources, okay? And that is where, if mental health professionals gear up, okay, and are able to use their intellect and their imagination to deliver mental health, I think I see a huge opportunity there. And that is the reason why I feel that NIMHANS has developed a module called ECO module. Okay, now this ECO model is telepsychiatry, okay, or telecounseling or telemedicine as it is generically called. Now this telemedicine, for a long time, mental health professionals kept it away. And they said that, well, mental health is about human to human contact, direct contact. It's not through the internet. It's e-platform cannot have that kind of. Now these are the walls that we created. Okay, and I think this COVID has been some kind of a blessing in disguise, because we have adopted to the e-platform much better than what we were doing before it. Okay, so this just tells me that yes, it's a different platform. It has its different nuances, and well, human species have found its way out of difficult situations for time immemorial, and it's our time to find what are the hurdles that this platform creates and how we can overcome it in order to deliver what we have learned. NIMHANS ECO model has proved its efficiency, and it's something that we should go ahead and work upon. So that means we require to be innovative. And innovation, I think, in mental health is extremely important, and that is going to be the future. Okay? If you ask me what is the future of mental health, it's going to be innovation. It's not going to happen. It's not going to be treating one individual in your consulting room. Gone are the days when you would say that, well, I will have my practice, I will sit in my consulting room, and whoever comes, I'll try my best to give him gyan. Okay, those days are now gone. Dr. Apurva Kumar Pandya, who is a scientist at Indian Institute of Public Health in Ahmedabad, he has written an article on innovations in mental health. And it is there on NIH website, National Institute of Health website. And well, he divides the innovations in 5 different ways. okay, in 5 different categories. Okay. The first is that improvement in quality of delivery of current mental. So whatever I'm doing, okay, I'll try to get better. Okay. So that is quality improvement. But what he feels is that in quality improvement, just like we would like to give better cognitive behavioral therapies, better psychoanalytical therapies, better pharmacotherapies, we would like to give some kind of a holistic approach when it comes to stakeholders. So it's not the person with mental illness is the only stakeholder, but probably his family member also is a stakeholder. The place where he works is also a stakeholder. The community that he lives in is also a stakeholder. So there has to be a stakeholder collaboration when we deliver mental health. Okay? And community coalitions, which I believe in, okay, is the only way to go ahead. And the significance of community coalitions is extremely important, and it's proven that if you go focus on community coalitions, that's the best way to go ahead. The second point that he emphasizes that when you are improving the quality of delivery of current whatever that you are delivering, the focus should be certainly on the rights of person with mental illness. So stakeholders and rights of persons with mental illness, if you have focus on that, and then you try to improve upon whatever that you want to deliver, that's going to be the best. The second, community-based intervention. So forget about the patient, the community at large. So creating awareness about the diseases, the pharmacological treatments, the adherence to the treatment, what is the role of psychosocial interventions, rehabilitations, with a focus on not symptom amelioration, but functionality and productivity. I've had a patient who was a typist, and he was fantastic. He was in one of the hospitals where I studied, and he was very fond of me, not because I am a psychiatrist and he was taking treatment from me, but I used to talk with him a lot. He had florid hallucinations, and he was a typist, and he had a fantastic speed, and he would never make a spelling mistake. And the unbelievable thing was that when he would type, he would talk to me when I was standing next to him. In between, he would talk to the voices that he were hearing, and he would still type without a single error. So wherein the symptom amelioration is redundant, it is not required. If he's functional, getting a salary which was feeding his family, he probably is still getting a pension. What was happening was, in search of a solution to his hallucinations, the medicines kept on increasing, his functionality came down. On reducing the medicines, his functionality improved, his children were happy, his wife was happy, his parents were happy. Fortunately, the hallucinations were not progressing, and that's the reason our relationship continued. The focus, as Dr. Apurva Kumar says, should be on functionality and productivity. The other reference that he made was that community coalitions. Okay, the famous Dawa and Dua project. Okay, Dawa in Hindi is medicines and Dua is blessings. In Unnava district in Gujarat, in a district called Sabakantha, I think, if I'm pronouncing it right, I don't know. I read it in his paper. The mental health professionals collaborated with the dargahs, the religious places, and they taught the religious preachers in identifying which are the diseases that they would be able to treat and which are the diseases that they would have to refer to a mental health professional. And they work in collaboration, okay, and that's the reason the reach of mental health has improved. So these community-based interventions are something that we need to work on. The third thing is that we mental health professionals are too possessive. We feel that it is our fiefdom. Okay, so psychologists believe that, okay, mental health the person with mental illness is my patient. Psychiatrists believe that it's their patient, and we have an issue with each other. Okay. But what was found was that non-specialist care programs, okay, where neither the psychiatrist nor the psychologist was there, but a structured program was in place, and it had fantastic results. Working with lay health workers, lay counselors, non-specialist health workers, not only increase the reach of the mental health program, but they increase the compliance of the person to take treatment, decreases the stigma around the mental health issues. Okay, and I can share my experience with, I work with Alcoholics Anonymous, which is a self-supporting program. And in 2005, I started going to interiors of Maharashtra in Vidarbha region, Marathwada region. And at that time, the number of sober alcoholics in attending Alcoholics Anonymous group was around 300. In the whole of Marathwada region, the number of sober alcoholics were 300. From 2005 to 2011, for 6 long years, I was going there once a year, and I was talking to the sober members of Alcoholics Anonymous, and they have something called mentorship. They call it sponsoring, and they have public information programs, so awareness about the disease. They go to villages, they go to workplaces, they go to schools and talk about how they recovered. And I was honored by their invites for their programs whenever they needed somebody to come. And I used to go from Mumbai. And by 2011, the number of people who were sober had risen from 300 to nearly 3,000. And after that, in 2011-12, Satyameva Jayate happened. And after that, the number of groups have risen to 3,000. So you can imagine that without a mental health professional, if the number of sober alcoholics has increased at no extra cost to the government or to the patient, or to the patient, isn't that fantastic? So that is the impact of community involvement. Okay, so non-specialist care programs need guidance. Yes, they need collaborations with mental health professionals, and we should stand there as Rock of Gibraltar behind all these initiatives. Then telemedicine. Okay, telemedicine in mental health again was a very gray area, but now it is established. Niemann's eco model has led us. The next thing that I see is mobile technology-based programs, and I'll be talking some in detail about mobile technology. George Institute of Global Health, I had not heard this name, but they developed a smart mental health program in Andhra Pradesh, I have been told. And on smart mobiles, they are developing apps which are to remind people of their appointments with their mental health professional, or some kind of premonitory signs of their mental health, or some encouraging messages to continue their treatment. It has been used in epilepsy treatment, and it has worked in the past. Okay. So that's the reason probably they must have thought of using it in mental health, and it has worked fantastically. Mobile technology, I feel, is used by non-specialists more than the specialists, okay? Because it removes the stigma, and it doesn't have, it's very convenient. I can use it anytime that I feel. I don't have to wait for an appointment. I don't have to see the consultants visiting hours. I don't have to see that. So there is convenience, there is anonymity. Then there is easy way of introduction to care. Okay, because the mobile technology comes with audio as well as visual, and it is standardized. Okay, so the standardization of whatever information that is being given can be, obviously it's lower cost. Okay, we just have to pay for the internet, and just like Google earns money through advertisements, I'm sure the app also would earn money. The scaling of your effort, the mental health reach, okay, can be humongous with mobile technology. You can have in-person extension. So if there are some complicated answers that are being given, then you can have in-person extensions to this technology. One of my computer wizard friends, who is a computer engineer, talked about machine learning. Okay, machine learning, and the way the person is responding, the interactive messaging system will keep changing its course of action. Okay, and machine learning is being used in these responses. We are still in a very gray zone, and we don't know how sure or how much we can depend on it. The question still remains: is it effective? Okay, that's the basic question. So whatever you are thinking, is it effective? Does it work at all? And does it work over all mental illnesses and duraces? Okay, we don't have a question to it. Is the privacy assured? Okay, we see that even on social media, privacy issues keep coming up, and there is a lot of talk about how anonymous are social medias, or whatever expressions that we have. Are they really restricted? The other fear is that these apps obviously have a potential for overselling. Okay, and if they oversell, then will people go away from individual counseling? Okay, which is time tested. Okay, which is tested, and it has a lot of evidence base. Okay, but if people shift their orientation from individual to mobile app, then might create a problem. Okay, there are multiple such apps. I'm using one of them. I use Runkeeper, which is my running app. Okay, and it is fantastic. Since I started using Runkeeper, I started becoming more regular with my running. So there are self-management apps. There are apps for improving thinking skills, I'm told. Skill training apps, illness management apps. Becomeanx.org, www.becomeanx.org is a nicotine addiction app. So I've seen it, and I've recommended it for my patients. There is something called passive symptom tracking apps, okay, where there are general health questionnaires, and you just have to tick, and the answer immediately promptly comes in, that whether you have to see a mental health professional or not. And then there are data collection apps, and there is research which has already begun on mobile apps. What I see here, okay, is that for people who are taking mental health as a career, there is an interactive course which is coming up, and that is psychology and engineering. Okay, till now I don't think any college offers that course. Okay, but I'm sure people who are well versed with this technology and who have a psychology background maybe have a future career in psychoengineering. I don't know what it will be called. Okay, I was amazed when I read a book on neurophilosophy. Okay, and I thought this is the ultimate that I would ever read as a title of a book. But I feel that maybe neuroengineering or psychoengineering is something I'm now getting ready for. Am I just talking out of my hat? Well, let me tell you that you guys have a fantastic opportunity in research, because in the financial year 2009 to 2015, National Institute of Mental Health, okay, which is the body in United States, awarded 404 grants totaling $445 million to technology enhanced mental health interventions. Okay, now when there are grants, what it means is there are scholarships, there are educational opportunities, there are opportunities to go abroad and study and learn. Okay, so this is big money, and this is, I could get information up to 2015, and I'm sure after 2015 the numbers must have increased. Now, significant portion of these grants, okay, is through small business innovation research and small business technology transfer. Now, small business innovation research is startups. Okay, for me, it is startups. So people who want to have startups in mobile technology helping mental health, okay, have an educational opportunity, and after that, a business opportunity, and the world becomes a field. So when I practiced my psychiatry and I was practicing in my consulting rooms, it was restricted to Bombay. When I started using the Zoom platform, suddenly I started getting patients from all over the world. Okay. Similarly, these apps, but because it is individual centric, it still happens in office hours. I am one of those few doctors who have practices from 10 o'clock to 7 o'clock. I don't see patients after 6:30. Okay. So still there are restrictions, but this technology opens up 24 hours for service. Okay. So your productivity time starts increasing. The NIMH has also created an advisory for mental health work groups on opportunities and challenges of developing information technology on behavioral and social science research. So it means business. Okay, so those people who are in the audience, okay, and who are pursuing a course of psychology, they have options of going away in a different field other than advertisement or human resource management or any other kind of offshoots from hardcore clinical psychology. They certainly can go towards something that is psychoengineering or whatever it might be called, or mobile apps in mental health. Summarizing, I think I've exhausted my 40 minutes, so I'll just summarize in 1 minute. I had seen a beautiful film when I was young, and it had a fantastic song. Que sera sera, whatever will be, will be. The future is not for us to see. Que sera sera. Well, I had loved the song, but I don't believe in it. I think the future is in our hands. And that's what you should believe at your age. Maybe once you become 80, you might not want to believe it, okay? But that's a different story altogether. At the age of 20, 25, okay, you should believe that future is in your hand. And believe me, future is as good as the hands that make it. Okay, so I don't believe in fate. I don't believe in. I'm an atheist that way. I believe in human goodness, okay? And each one of you is in that phase of life where you would be dreaming about success. Okay, and Franz Kafka, one of my most liked authors, has written a short story on In Search of Success, and I'm going to share that story with you, and then I'll be relieving you of the stress that I might have introduced in your life. Well, there is a young man in a small village in France, and a child, very bright. He has a school in that village up to 7th standard, and everything that he does, he masters. And he says that everybody is proud of him. The whole village is proud of him. So he desperately wants success. So he goes to his teacher and says that, teacher, I want success. What do I do now? So he says, the teacher tells him that, well, you want success, but the village offers limited opportunities. So you might have to leave the village. So he said, I'm ready. So he says, do you see this road going out of the village? So, yes. Do you see that climbing over the hill? Yes. Cross the hill. Once you go down the hill, on the other side, you would see a beautiful lake and the road just passes besides it. After you pass the lake, there would be a field, and in that field, you would see a beautifully carved wooden door. Go there, knock on it. That's the door for your success. So his eyes brighten up. He says, tomorrow it will be. I will start my journey tomorrow. So young man starts in the morning, and he reaches the road, climbs up the hill, climbs down the hill, sees the lake, goes to the field, sees the decorated door. He goes there, and at his surprise, he says that, well, the teacher told me exactly what would happen, but he did not tell me one thing. there was a monstrous chowkidar at the door, and he's guarding the door. So the student said that, well, this was not something that teacher told me. So he goes there, and a bit with hesitancy, he asks him that, well, I'm so and my teacher told me if this is the door to success, I need to go there. So he says, what's your age? So he says, I'm 13. So he says, 13 and you want to be successful? No, no. Success is not get ready for you. So he says, what do you mean? So he says, what do I have to do in order to get ready? So the man says that, well, you've not experienced life at all. What do you know? He said, I've studied till 7th. So he said, 7th? That's not enough. You might be literate, you might be numerate, but you need to know all the arts, you need to know all the sports, then you might come here and knock on the door. So he said, but my teacher told me so. So he said, young man, I can let you go in, but there are 12 such more doors inside. And each of those doors would have a uglier, monstrous looking person waiting there. And once you enter, you can't come out. So it's your choice. So the child, this young boy starts thinking, he says, maybe it will be better if I learn the arts and the sports. So he comes back, learns his arts and sports, and at a tender age of 21, 22, he's an expert in everything. So he again goes back. Says, still not ready. Why? I have learned my studies, I have learned my sciences, I have learned my arts, I have learned my sports. So he said, well, are you married? So he said, what has marriage to do with success? So he says, well, marriage is an important part, having children is an important part, growing them up is an important part, and then only you can get success. Success is not only about science or how well you do in sports, but it's about everything. So he says, well, again he says, thinks about the 12 doors and the 12 monsters and can't come out. So he says, okay, I'll go back. So he goes back, marries somebody, has children, the children grow up, and they are as bright as him. So he comes to the middle age where children are now being settled. He says that there are responsibilities. He gets his children married. And at the age of 55, 60, he says, maybe now I can reach there. So he goes there. He says that, well, you are a very insistent person, my dear man. You keep coming back. So he said, but you don't understand the simple reason. The most crucial part of human life, that is aging. Okay? You have not experienced it. How can you be successful? How can you even reach success? So he says, what do you want me to do? He says that age gracefully. And once you age gracefully, if that you are able to do, then you come back. So he goes back, plays with his grandchildren. And then one day he realizes that his health is giving up. So when his health is giving up, he says that, well, now my grandchildren are also, and my children are very mature. They will take care of the grandchildren. Now it's my time. So he takes a stake where with a lot of difficulty, he climbs the hill, reaches the door. And there by the time he reaches, he is coughing all the time. And he falls down in front of that monstrous chowkidar and says that, boss, now let me in. So he says, what are you going to do now? You are at the end of your life. Okay. Now, what does success mean to you? So he says, no, but let me in now, at least one door. So rather than letting him in, he starts dismantling the doors. So the man is perturbed. He says that, okay, you did not allow me to go anytime. Okay. Let others, please let others, for others, keep the door there. So the monster tells him, gentleman, this was a specific door for you. You did not take the challenges. So this door will not help anybody else. So each man has to carry his own cross, even in success. So friends, it was a pleasure talking to you. And I wish you all the luck for your future endeavors, and try to enjoy the journey. That's the most crucial thing. And try to be innovative and creative. Don't think that your excellence in subjects that you are studying right now are going to be the key factor in your success. Okay, I was never a excellent student in my life. Okay, but I have enjoyed the journey, and that's the reason I'm here. Okay, and this is, I think this is something, this interaction that I'm having. For a long time, I have not had such exciting interaction with my colleagues. Okay, because I love talking to students. So take care, be positive, enjoy the journey, and be innovative. Thank you so much.
Thank you, sir, for a very eloquent talk. It was very interesting and very engaging. So you indeed threw light to a rich and diverse spectrum of topics that are undoubtedly relevant for thought amongst the mental health professionals today, and also those who are aspiring to become one in the near future. I'm sure that the students and the audience would have earned an extensive amount of knowledge and absorbed very refreshing insights on the topic that you brought in for discussion from your speech. We would now like to proceed with the Q&A session. As mentioned earlier, requesting the audience to type in their questions in the comments section of the YouTube live stream. I will be reading out the questions to the speaker, and sir will be answering it. Sir, I believe we have a couple of good questions in. So
Yeah.
the first question from the audience is, we have been at home all this lockdown, therefore sure has been a toll on the mental health. How must we take care of our health and our families too?
Okay. Albert Ellis once said, it is not the situation, but what I think about the situation that matters. Right? I don't know whether you've read Edward de Bono. Edward de Bono is an author and a person who created the concept of lateral thinking. Okay, it is not logical, but not illogical. He calls it non-logical. And he gives an example where he calls himself a thinkologist, and he earns his living. He earned his living. I don't know whether he still exists. I'm sorry, but I don't know. In the World Trade Center, okay, which was built in Chicago, the first multi-135 storied building. And the top floors were taken up by the top executives who would find it very difficult to reach because of the time taken. You know, in all the skyscrapers, there is the proportion of lifts to the number of floors. Architects have a particular formula, and they have express lifts. But in spite of all those, the people started complaining that these lifts are very slow. And because of the structural reasons, they couldn't make them fast. And the people kept on complaining. People kept on complaining about the speed. And to the extent that they threatened the management that we would disinvest, because morning times are extremely crucial, because World Trade Center, United States of America, millions of dollars matter in the morning times. So they said that we might as well shift to a building next door, which has 3 or 4 stories, and which will save a lot of money for us. Well, engineers, had no solution for that. And somebody suggested Edward de Bono's name. And Edward de Bono came there and saw the situation and said that, well, he would require something like $153 to solve the problem. And everybody was surprised. And he said $1 million will be his fee. So $153 for a solution, and $1 million as his fee. So he said, "Arey, ek koi to topi laga raha hai." So then they said, okay, you have a memorandum of understanding. We do a survey after 1 month of implementation. And if the comments have changed, then you pay me the 1 million. Otherwise, just $150 is what you lose. And what he did was, that was the first time in elevators, mirrors were kept. Okay, now you see that any elevator has a mirror, and you would not know why there is a mirror in the lift. Okay, the reason is that what he said was that the time was not important. The awareness of passing time was important. Okay, so when these executives would enter a lift with a mirror, okay, they would probably make their tie properly, or what they would see how they are looking or whatever. Okay, and in that they would, their awareness of passing time would go down. Okay, and literally after 1 month, the comments, and now the lifts have been made fast. Now we are comfortable. Okay, so my solution to this is that, well, yes, I know that all of us are going through difficult times. In fact, Maharashtra and Kerala, your state, Kerala, we are experiencing again a rise in, and we might go for a lockdown again. What is important is that we should understand that it's a fact that if at all the number of cases increase, for our own sake, we will have to go for a lockdown. Okay, and when we go for a lockdown, we don't have an option. Okay, then we have to find what will keep me healthy and happy. Okay, now in keeping healthy and happy, that's not the only thing. I, as a professional, I need to do something else. Okay, so what are my goals? Okay, and other thing is that, okay, everybody in the house is going to be at home. Okay, and we are not used to having these people. They are our people, they are family. Okay, but we are not used to having them around for 24 hours. Okay, so familiarity breeds contempt. Okay, so there are frictions that are likely to happen. Okay, so we have to keep ourselves away from conflict with others and obviously with ourselves. Okay, so the way we communicate needs to change with each other. And what I narrated right now are the 5 golden rules of rational self-analysis, nothing else. Okay, so what are those 5 rational rules? Okay, whatever you are thinking, whether it's a fact or an opinion, go by that. If it's a fact, yes, you need to follow it. Okay, come what may. Is it going to keep you healthy and happy? Whatever you are doing, is it going to keep you healthy and happy? Okay, if you believe so, and if it has a scientific evidence to it, then do it. Okay, is it going to help you achieve your goals? So if you are disturbed about something, about what your brother did, what your sister did, what your mother said, what your father said, okay, is it going to help you achieve your goal? Whatever that you do, is it going to help you achieve your goal? It could be a misunderstanding, it could be your mistake, it could be their mistake, whatever it is. But whatever response that you show, is it going to help you achieve that goal? Is it going to keep you away from significant conflict with yourself or significant conflict with others? So if more than 3 rules of these 5 rules you are following, okay, then it is likely that it will resolve the conflict. You are thinking in a direction where you will be able to resolve the conflict. Okay? So the answering your question, well, to tell you frankly, you have to believe in mental health principles in order to find solutions in your own house. Okay, so what I have believed is that these 5 rational rules, golden rules of rational thinking, self-analysis, they work tremendously. Does that mean that you will be able to master each and every situation? No. Okay, but out of 10 situations, even if you master 5, you have 50% conflict-free zones. Okay, and I think that's something very, very good.
Thank you, sir, for your answer, sir. I hope it has answered the query for the audience members. There is another question I think that a lot of people in the audience have asked, which is, how can students and youth aspiring to be mental health professionals work towards reducing the taboo associated with seeking professional help for mental health issues?
Well, the only way you can reduce the taboo is creating awareness. Okay, so you have to go all cylinders fired in the community and talk about mental health. Okay, is the taboo only in communities? No. Okay, if you see in psychiatrists and psychologists, okay, the incidence of taking mental health interventions is very low. Okay, so it's not only in the communities, even in mental health professionals, the taboo exists. Okay, so it's something that will grow with more and more awareness. Okay, so the other thing that you need to do is that in physical health, the last mile run is very clear. So suppose somebody has loose motions, okay, and we understand that it is because of bad water that he is drinking, then we can tell him that boil water, boil it for 3 minutes. When it cools down, then drink it. Okay. So there is nothing in any language, there is nothing that is kept for imagination. Okay. But when you talk to parents about how to do parenting, you talk about tender, loving care. Now, when I talk about tender, loving care, okay, TLC, okay, it's an abstract word, set of words. Okay, what does it exactly entail? Nobody knows. So that is the reason why the last mile run in mental health, okay, remains abstract, and that's the reason why the taboo exists. Okay, the taboo exists because of the uncertainty and the unknown part of mental health. Okay, so we have to run the last mile better than what we have been running. Okay, and then probably the taboo, I hope, would go away.
Thank you so much, sir, for the answer. Definitely, we should try to reduce the uncertainty and the unknown aspects of mental health and hence promote it. Due to time constraints, unfortunately, we will not be able to take up any more questions from the audience, but we definitely appreciate the very educational questions from your end and the active participation in the session. Thank you, sir, for answering the queries of the audience. The famous American author and motivational speaker Zig Ziglar once said, and I quote, "Gratitude is the healthiest of all human emotions. The more you express gratitude for what you have, the more likely you will have even more to express gratitude for." I would like to express my profound gratitude to everyone who has contributed to make this event a successful one. On behalf of the University Student Council and the management of Christ deemed to be University, I take this opportunity to thank our keynote speaker, Dr. Ashish Deshpande, for taking time out of his busy schedule and gracing us with his presence and enlightening us with his deep-rooted knowledge and experience in his field of expertise. I would like to thank the Controller of Examinations and Director of Student Council, Professor Johnny Joseph, sir, who has always inspired and encouraged us. Heartfelt thanks to all the faculty coordinators of the Student Council for their continuous guidance and motivation. I would like to acknowledge and appreciate the efforts from my fellow University Student Council members who are part of the events, technical and logistics committees for their consistent support, without which the smooth conduct of this session would not have been possible. Last, but definitely not the least, I thank all the Christites present and all the external participants for joining us and being such a wonderful and participative audience.